Everyone, it's Marcy. It is Tuesday. We are home from the Mayo Clinic, obviously. I waited so long to make this video because I was hoping to hear something from the main doctor I had, who was head of it. I was hoping to hear from her on Monday, but I haven't yet. They're probably still going over my test results. Now, they added 2 extra days of tests, and that caused some confusion with our hotel because we weren't sure if it was going to be 1 day or 2 days or how long we were going to have to be there. Originally it was 3 extra days. And the Best Price Inn, I really have to applaud them. They were great. They worked with us. They weren't upset or snarky. It's run by a husband and a wife team. They have very strong accents, but I'm not sure from where. And they actually have a van that they will use as a shuttle for you. So you just tell them when you need to be there and about what time you need to come back. If you're not 100% sure, they're okay with that. Though he doesn't do the shuttle until 6:30 in the morning, which I think is fair. Who wants to be up that early? So just know that if you go to the Best Price Inn, let them know that you're going to be going to the Mayo Clinic and that you will need a shuttle, what time you need to leave, and that sort of thing. And they're very, very accommodating, very wonderful people, and very, very well priced. I definitely recommend them. The trip home was rainy, not so much fun. We had to stop on the side of the road a couple times, and that area south of Rochester is not very good for cell phones. If you don't have like one of the really, really expensive providers, expect no cell service if you're going south. It got kind of hairy. But anyway, I don't really know much about my diagnosis or prognosis at this point. She said I'm a very good candidate for this surgery. I have one of the more severe cases of hypertrophic cardiomyopathy that she's seen. The chambers in my heart on the left side are almost fully closed. There's just a very thin strip of open chambers for the blood to go through. So it's pretty severe. I do see the surgeon and talk with the surgeon on the 20th, so I have to go back up on the 20th. And if anyone is wondering how I can be asking for money for my surgery and expenses when, hey, I made it there and back just fine, I have to let you know that we did not do it on our dime. My mother was really wonderful. She's older and she doesn't have hardly any money herself. My girlfriend's indicating that my mother is an angel, but we could argue that, but most of the time, yes. But she lent us her car, her Sam's Club credit card to fill her car, and just a general credit card. So we've put my mom in quite a bit of debt just to go there for my initial tests. Probably do it again on the 20th, even though we've pretty much maxed out her Sam's Club card. So, and we still have expenses here at home. We have rent that's backing up. We don't know when our internet's going to go. It probably soon. We have electricity bills. All this because I have this condition, and any job that I could get with my limitations say, well, you're kind of an insurance liability at this point, so we're probably not going to hire you. So it makes it really, really difficult. Yes, I could answer phones. Yes, I could fill out paperwork, but places are worried about me being a liability to their insurance, which you can kind of see, you know. So it's a right to work state here in Iowa, unfortunately, which means a right to fire at will and a right to not hire you at will, even if you qualify or whatever. So there's some of the frustrations we're dealing with on top of my diagnosis, and they have upped. I said before that they said I would have heart surgery within the next 5 years for sure. They've upped that. Now they're saying I'm going to definitely have surgery within the next 2. So that's one of the things I'll be talking to the surgeon with about, and hopefully I hear from the doctors before that so I have a little bit of understanding. Now, if you have hypertrophic cardiomyopathy and you go to the Mayo Clinic and they do the stress test on you, I will warn you on something that happens to me. Once I got there where my heart was really pounding and I was really short of breath, I tasted blood in the back of my throat. That's actually normal for someone with our condition, because what happens is your body floods your lungs with blood, bringing in oxygen, and then your heart can't pump it out of your lungs fast enough because there's an artery that goes straight from your lungs to your heart to re-energize. So keep that in mind. If you have that, don't be afraid. You're not actually going to have blood come out of your throat or your mouth, but that is a condition. Also, 1/3 of all people who have this condition have if they eat too much or they eat too many easy digestible carbs, that they feel short of breath and chest tightness, and that's actually something that happens because of the condition. So if you have a few of the symptoms and then you have this one unexplainable symptom that no doctor listens to you about, because none of mine did, definitely have your heart checked out, because that is a symptom for 1 in 3 people with this condition. Just wanted to put that out there because I was flabbergasted when she told me about it, because I've mentioned this to doctors for the past, I think, 10 years, and they just brushed it off. Well, if you feel short of breath after eating pasta, don't eat pasta. Well, it's not quite that simple. No one could tell me why, and no one was interested in finding out why. Now I know, hey, it's a symptom of your heart condition, which is rare and should be checked out. So, interesting information for anyone with that. Well, this is getting a little too long. I'll let you go. See you next time.